Hello, thank you very much for joining me today. My name is Sam if you're new around here, and I am pregnant with my second baby. I am 30 weeks pregnant and today I'm going to film my second trimester. I will link my first one down below. I am a mum already to a 4.5-year-old little girl called Cleo. She's an absolute delight. She's a firecracker actually. She's just started reception and I found out I was pregnant with this baby at the beginning of April. I miscarried with Cleo, then I had Cleo and then I had a miscarriage last year, and then I found out I was pregnant in April with this baby. All babies are miracles, but I just especially after you have loss, it's really hard, and we've been trying so long to have Cleo, 3 years, and I think for this baby it was 2 years. So I feel immensely grateful and immensely blessed to even be filming an update like this. But yeah, second trimester, I had my booking in appointment at 9 weeks, and I remember then, I don't know if I included this in my first trimester update, the midwife phoned me back and said, because of your history of miscarriages, we want you to take 75 milligrams of aspirin every day. I managed to get it kind of over the counter at the pharmacy, and basically it helps with blood flow, so they didn't want there to be any interruption to the baby's blood flow. So when you take aspirin, it thins the blood and it just helps the blood flow more easily to the baby. I wasn't overly keen, to be honest with you, about taking aspirin, because normally I don't really take paracetamol or ibuprofen when I've got a headache or anything. I just kind of grin and bear it. But she was saying it's protective for the baby, it's protective for the pregnancy, so I took it. Then when I had my 12-week scan, the consultant obstetrician said, blood flow is fine, you have low blood pressure, so there's no need for you to continue taking it. So I took the aspirin from 9 to 12 weeks. It's perfectly safe in pregnancy. I am just personally glad that I'm not taking it now. I had gestational diabetes in my first pregnancy with Cleo. I was diagnosed at 28 weeks, so the last 12 weeks of pregnancy with her, it was really hard. And I remember getting the phone call from the clinic to say, on Boxing Day, you have gestational diabetes, and it's really hard not to take it personally. It's not something that you have done or you failed to do or you could have done better. It's just, I think it's just genetic. I blame my ethnicity. I had an inkling that I might get it again in this second pregnancy, but I wasn't expecting them to test me so early. So I got a letter from the hospital to say at 17 weeks, can you come in for a glucose tolerance test, which involved going to the hospital, fasting for 12 hours before. They took my bloods to see what my sugars were like. Then I took a really horrible sugary drink. It was really rank, and then I had to sit in the waiting room for 2 hours, and then they took my bloods again. And I got the results about a week later, and I don't know, I had a little inkling, because whenever I ate bread, my mouth just had this horrible taste after, so I had an inkling that maybe, it was kicking in. And then the midwife said to me, yes, you're just on the border. And I said, well, what do you mean on the border? She said, well, you had to have had less than 7.8 after 2 hours of having the sugary drink, and yours was 8. I was like, oh, come on, come on, I'm literally just 0.2 over. And the lady was laughing. She was just saying no, because as the pregnancy progresses, as the placenta and the baby gets bigger, the demands on insulin will be more, and your body won't be able to produce enough. Yeah, I was diagnosed last time 28 weeks, this time 17 weeks. So it's been a lot harder this time round, because I am generally someone who looks forward to eating meals. I'm not someone actually who's ever had a particularly sweet tooth. So if we've gone to a birthday party, I would be like, oh, I'm okay, I don't need any birthday cake. But when you're categorically told you can't have sugar, chocolate, fizzy drinks, desserts, ice cream, it's really hard not to think about those things. Obviously you just have to completely cut out those sugary foods, but the diet is more kind of focused on controlling your carbohydrates. So carbohydrates are chips, bread, rice. In my instance, I love eating rice, so I've gone from eating white basmati rice to brown basmati rice, and there is a difference. And whole wheat pasta, which I was eating anyway. When I do a spag bowl, I'll get the whole wheat brown version. So yeah, it's about no sugars at all. That's just a given. They almost don't even say it. They're just no sugars. And then you have to control your carbs. So I'm allowed a certain amount of grams of carbs every day. I'm part of a diabetes clinic, so they give you a tester. So I test my bloods on this little gadget, and I have the testing strips, and then I also have a little needle that I use every day to kind of prick my fingers. I've got lots of little lancets because I have to prick my fingers 4 times a day when I wake up, an hour after breakfast, an hour after lunch, and an hour after dinner. And all of my readings have to be under 7. If they are consistently over that, then I have to go on metformin or insulin. And actually, when they gave me the testing kit, the blood testing kit. They gave me like 3 or 4 packets of metformin. I was like, hold on, like with Cleo, I managed just to control the diabetes with diet alone. So is the expectation not the same now? And they said no, because you've been diagnosed much earlier. Once you get to the 3rd trimester, it's highly likely, like they showed me a graph and everything, it's pretty much unheard of for a woman to be able to just control it with diet till the end. So I have the metformin and I have the insulin. My readings actually have been really, really good. So like I said, because I have gestational diabetes and because of my age, my maternal age is over 40. I'm only just 40. My pregnancy is classed as high risk. So I basically go to the diabetes clinic about once a month, and they take my blood pressure. They have to check what I've been eating, all of my readings. I see I don't know who I see. I see the diabetes nurse, I see the midwife, I see the consultant obstetrician. I have to have a scan every 4 weeks from 28 weeks. So 28, 32, 36. I'll have scans, growth scans, to see how the baby is, because they don't want the baby getting too big. So the main issue with gestational diabetes is that the baby will get too much glucose, sugar from me, if it's uncontrolled, and that means that baby will get big, and that can cause issues with, you know, birth, coming out of the vaginal canal. You don't want a baby that has shoulder problems because it is too big, and then when they're actually born, they can get really severe jaundice, and they can also have hypoglycemia, where they're so used to getting so much sugar from you, they're not able to cope with it, just with not having that sugar, and then not being able to produce enough insulin. So there's lots of complications, and there's lots of incentives for me to follow this diet really rigidly. I'm 30 weeks today, no, 30 weeks tomorrow, 31 weeks tomorrow, and I feel really proud that I'm not on any medication just yet. And that's not to say I won't be going on it. I think if actually I do end up going on it, I'll prefer to have the insulin and just inject myself either in my stomach, my legs, or my bum, rather than taking the metformin, because I think the metformin crosses over the placenta, and for me personally, I just don't think that I would be happy with that. I'd rather just give myself some more like finger pricks, or no, belly pricks. And you know what, it's so weird, like I've been thinking about trifle and chocolate ice cream so much. Like I would never normally eat a trifle. It's the whole consistency of like the cream, the custard and the jelly, it's just ew, it's gross. But I can't stop thinking about it, and I'm not gonna like even sit here and pretend that I haven't bought a couple and eaten them.
Shall I eat your trifle, put you out your misery?
Yes.
So you can have a mouthful, yeah?
I'll have a mouthful and then
it's
you can
open, then you don't have to worry about it. I really don't think you should buy it anymore.
I know, but I keep thinking about it.
It's not good for you.
Oh man, that cream. Get the
I really
spoon.
don't see what you love about them.
I don't normally.
See, my mum used to make trifle, right, and they had like sponge at the bottom, but this doesn't even have sponge. It's just like cream and fruit and jelly. It's like...
But that's my craving, and I can't have it. So get the spoon out and let me have a mouthful.
Okay, is it going to make you spike?
Let me just see this. Look, it's that creamy bit at the top. Oh. Look at that jelly and like the cream and the custard. Take it away, it's so nice.
I had my 28-week scan and everything was fine in terms of the baby's weight. Everything was normal, nothing was abnormal in terms of the baby being too big. So I kind of give myself those little treats. I have noticed that I can't get away with eating what I could do earlier on in the pregnancy now, because I will get the spikes. And actually every week the dietitian texts me and she says, oh, well done on your readings. Oh, you spiked this time because you had like black bean and jasmine rice. Try and stick to the basmati. So I feel very supportive. I also feel like I'm very much being watched and monitored, which is a good thing, not just for me, but also for the baby. Most mornings I just have porridge. I've been actually really craving porridge with walnuts, chia seeds and some blueberries. I can only have 2 tablespoons of porridge. Anything more than that will spike me. I'll get a reading over 7. I've been having full fat Greek yogurt, again with walnuts, chia seeds and berries. I was eating a lot of egg on toast, but I've not been fancying it. Lunch is usually a soup, and then dinner is usually like basmati rice or whole wheat pasta with a protein and vegetables. So one of my top tips when I'm eating a plate of food like this is to start off by eating the protein first, then the vegetables, and then the carbohydrates. If you do it in that order, then your blood sugars are less likely to spike because you're not starting off with carbohydrates, which your body turns into glucose, and then you'll get that spike immediately. And an hour after eating this meal, and I would say there was a fair few chips on there, my blood sugars were 6.6.
All of my readings need to be under 7.
I then upload that to my GDM app via Bluetooth, and all that information gets sent off to the diabetes care team, and I have to write in the comments what my meals were, and then they can then get back to me about if there were any spikes, what I could change. And snacks, you can have like fruit, so they don't deprive you of fruit because fruit is obviously full of like really good nutrients, but you have to be careful with the amount of fruit that you do have. And then like in the evenings, you are allowed to have like a biscuit. I think it's meant to be 15 grams of carbs, so I can have like some crisps or like a biscuit, you know. It's like just taking the pleasure in the little luxuries now. Movement. So I think about 9 weeks, very early on, I was able to feel the baby kind of fluttered, like little flutters in my stomach. I remember driving down to see my friends and I could feel the baby. It felt like almost like butterflies. The feelings have just got stronger and stronger. And what does it say here? 21 weeks, I could actually feel kicks and jabs. And do you know what? It's really helped me to bond with the baby. I think before that I was a bit worried, like I really love Cleo, how could I possibly have enough love to love another child? And yeah, definitely the kicks and the little jabs have helped me to bond with the baby. I was lying there at 4 in the morning getting loads of kicks, and I felt like the baby was moving my organs around, but it's definitely helped me to bond with the baby. Like I speak to the baby and I'm like, I love you. Mel's been playing piano. Cleo every morning is like, morning baby, and she'll come and kiss my tummy, and it's like the cutest thing. I said actually on Instagram, if any of you don't follow me on there, please do give me a follow. My handle is Sammy Instagram, but I think 2 or 3 weeks ago I had really bad leg cramps in like my calves, so my left calf and in my right calf. In the middle of the night when I was sleeping, you can just feel, it feels like someone's squeezing your leg, and it's so painful. And I think with Cleo I had it in my right leg maybe twice, but I've had it 3 or 4 times, and you can't even point and flex your foot to release it or to relieve it, and it's just so painful. And I literally have just been lying there trying not to breathe or anything. And I asked some of you on Instagram, and you really kindly gave me lots of advice, which has helped, because ever since then I haven't had any leg cramps. So I'm so thankful. We had the 20-week scan, and at the 20-week scan you can find out the sex. We did find out the sex. I think I told you at the 12-week scan we had a 65% chance of it being a certain gender, and at the 20-week scan, like, I actually didn't really want to know. I quite liked not knowing with Cleo whether we were having a boy or girl, so that when she came out and they handed her over, we were both like looking at her at Cleo's genitals. But Mel really wanted to find out, I think for practical reasons, in terms of, you know, can we reuse the same clothes, things like that. We did find out the sex. I am going to do a gender reveal in the next kind of like couple of videos. I'm going to film one for you. It's going to be a funny one, not your traditional gender reveal. And also at 28 weeks, I had another scan, which was like 2 weeks ago now. And that's a growth scan, just to make sure that the baby was in the normal ranges for weight and all the other checks that they do. The baby is, and I also said that the baby is breech. So even at 20 weeks, I looked at my notes and the baby was bummed down, so that's breech, right? And I can actually feel that the baby is breech, because I think the baby's head is just here under my ribs, and I'm getting all the punches here, and then I'm getting all these little kicks down here on my bladder. I'm just really hoping and praying. I've been talking to the baby and saying to the baby, I hope that you can move and get head down, because actually it feels really tight across my stomach. And when the baby turns, like when you've got the back of the head here, and like I almost feel like the bum here, my stomach feels so much tighter than what I remember how it was with Cleo. Cleo was head down, I think, from pretty early on. They have talked about an ECV, which is kind of like a manipulation of the stomach. So I would have some muscle relaxant injection, and then they would put a fetal heart rate monitor on the baby, and then they would try to turn the baby. I actually think that that's not something that I want to do. I don't want to cause any distress to the baby, and they said they put the heart rate monitor on there to see if the baby's heart rate rises, and I'm just like, do you know what, I don't want the baby to get damaged in my womb, just because, you know, I would like to have a vaginal delivery. I actually don't mind. As long as the baby comes out healthy and whole, I really don't care if I have a vaginal delivery like I did with Cleo or have a C-section. So I think if the baby has not turned by 36 weeks, they will offer me a C-section, a planned C-section. So I kind of think of it as vaginal delivery is good because you don't have like the major surgery and you're just able to get up and get on with things. But the C-section is also good in that I don't have to endure 17 hours of contractions, pain, and all the uncertainty of that. So there are plus and minuses of both. I'm just trying to focus on the pluses of each. And my teeth. Finally, I'm going to talk about my teeth. With Cleo, I had like this weird growth at the back of my front tooth. This time around, I haven't had that. I have had bleeding gums, and they got bad that I went to go and see the hygienist. She gave them a good clean. She spent about half an hour cleaning my teeth, scraping the enamel, and then when I came home and flossed and brushed my teeth, I wasn't having any bleeding, and now bleeding is just minimal. So I think actually if you're pregnant, you should go and see the hygienist every 3 months. It's a really good investment. I know seeing a hygienist is not cheap. I have to pay £60 or £70, but it is totally worth it. There's nothing worse than flossing and having a mouthful of blood. It's just horrible because you have so much extra blood flow going around your body anyway. I highly recommend that. Top tip, go and see a hygienist if you're pregnant and you're having bleeding gums or any kind of issues. See your dentist first, then see the hygienist. I just wanted to talk to you about a couple of products that I'm using. So because my stomach has been feeling so tight, I have bought this, what's it called? Mama Mio belly rub cream thing. I got the big gigantic pot. It's about £19. It smells really nice. There is a scent to it. I think it's like lavender or something, but it's not too like, doesn't smell like an old lady. I've been rubbing that on my bum on my bump after a shower, and it's really helped relieve like the tightness, especially when the baby turns. It's so tight. I know that because I have stretch marks from my previous pregnancy, I cannot do anything to prevent the stretch marks, but this does give me relief, and it feels like I'm doing something to try and help. I've also been taking pregnancy vitamins. The ones that I've been using are Pregnacare Max. So it's a 2 for 3. If you go into Sains Superdrug or Boots, you get 3 for 2. They're about £20 each. And then because I work for the NHS, I get another 10% off. So I got it like 3 for £35. Basically, you have like a green tablet and then a yellow tablet for the omegas. And I take those every day. It's important to take them every day at the same time of day. So this is my bump at 30 weeks. I'm quite low, I think. I think because baby is breech, it's all like bum here, bum and legs. So baby does feel quite low. Tummy is very hard. Yummy tummy. And yeah, that's how I look at the moment. I've actually been really lucky that because it's been summer for most of the pregnancy, I've been able just to wear dresses and stuff. But now it's coming to like winter time, I've got to get out my maternity jeans, and I hate my maternity jeans. I just feel like they're so unflattering, and even like the maternity tops. I've just been going to like Primark or New Look and buying like extra large t-shirts because I just do not enjoy wearing maternity wear. So I have been lucky in that I can wear like nice dresses like this, but I'm not looking forward to putting on maternity jeans. They're just horrendous. But yeah, look, baby is baking very nicely in the oven. That is the end of my second trimester update. I hope that you've like enjoyed hearing about how I've been getting on. I think on the whole I've been doing okay. It's not easy, to be honest with you, especially not with the diabetes, because I love and think about food all the time.
I love this image of the baby where the baby's legs and feet are up over the face. There's so much more movement this time. I don't know if it's because I'm more aware of it or more sensitive to it because it's my second pregnancy, but I'm feeling lots of kicks, lots of movement, and I just can't wait to meet the baby. Thank you so much for watching my second trimester update. Please do subscribe and follow me on Instagram for baby bump pictures and my baby journey. And yeah, I'll see you soon in my next one. Bye.